Last year, we introduced our updated mission to promote optimal mental health for youth in Greater Cincinnati through stigma reduction and customized, evidence-based education so that we live in a world without suicide. To achieve this mission, we work in 5 pillar areas: stigma reduction, community engagement, programming and education, policy and advocacy, and measurement and data. Let's take a look at some of our 2019 work. From parent education sessions to staff professional development to mindfulness, we take every opportunity available to connect with individuals to stop the stigma around mental health and normalize the conversation. We believe that the more people talking about mental health and wellness, the more likely people will be to seek help. Another great tool we have to reduce stigma is our social media platforms. From curating our own content to sharing what is trending, we are able to start the conversation daily. In 2019, we shared over 35 personal stories, the I Am 1 in 5 videos, and our Warrior Wednesday written stories, reaching over 140,000 people. Last year was a busy one for the 1 in 5 staff. We attended and/or spoke at over 78 community events, which includes QPR trainings, free educational events, trivia nights at local breweries, partnerships with local athletes and teams, cooking competitions, and much, much more, allowing us to reach over 40,000 local people. These events allow us to meet people where they are and start the conversation. Additionally, we hosted our 10th annual Warrior Run 5K in October, and we had over 3,500 participants all coming together to stop the stigma and promote mental wellness in our community. We are so proud to announce that we are now working with 65 area schools and all 5 universities to implement customized, evidence-based mental health education programming. We create and implement a holistic, unique plan with each school, which ranges from funding signs of suicide, the universal suicide screener, to facilitating our recommended peer-led programs, sources of strength or bring change to mind, to providing mindfulness training for teachers, staff, and students. These programs have already helped save lives and will continue to do so. This year, we actively work to get House Bill 532 off the ground, a bill that gets mental health education into schools. Nancy Eigelmiller, Sarah Bitter, and our intern Corinna Cash worked tirelessly on this bill. Many phone calls and a few visits to the State House later, House Bill 532 was introduced to the legislature in March of this year. Since no 2 schools are the same, we recognize that we need to truly understand the climate and culture of a school to ensure we are meeting the needs of the students, staff, and families. This is why we conduct a needs assessment and climate survey with each school we work with to assess students, staff, and parents' knowledge about mental health and resources available. We then use this information to determine the next steps for programming. Additionally, in 2019, we received funding from Fifth Third Foundation for a 3-year-long research project, allowing us to partner with Cincinnati Children's Hospital to identify the hot spots for psychiatric visits in the last year. This will allow us to work in the areas with the highest need. As we look back at 2019, we are so grateful to everyone that helped us achieve this essential work. From sponsors to donors to volunteers, thank you. We would not be able to positively impact our community without your support.